overdosed countless times. My life continued to spiral out. At the time when I was looking for treatment, there was only two treatment centers that served people who had heroin addiction. The staff didn't look like me, and so I came back to Minneapolis, and I wanted to continue my recovery journey, and I did that through a MAT outpatient programming, where this program had people that looked like me, people who had lived experience, and I was able to connect.
Hello, everyone. Thank you for tuning in to Stories from the Field, a series of podcasts that dive into the issue of the evolving opioid epidemic in Minnesota. Our goal? Simple: to give voice to those who are or have experienced substance use disorder and to provide perspective into the issue. I'm Julie Barkey, and welcome to Stories from the Field. We are joined by three Minnesotans who have unique insight on opioid use and how it impacts many Minnesotans of color. Pearl Evans is a woman in recovery, and she's using her experiences to now help others. Clarence Jones is the community health strategist for the Human Partnership. His role is to hear the community's public health concerns, find allies to collaborate with, and to address these issues. And finally, Yusuf Shafi. He's an active and very well-respected member of the addiction community in Minnesota. And in 2015, he opened the Alliance Wellness Center, which is a substance abuse outpatient and inpatient treatment program. All of you, thank you so much for joining today. And I'd like to begin this podcast with Pearl. She has a very unique experience with opioid use, and it's one that many might be able to relate to. So Pearl, do you mind, with all of your insight and experiences, can you just maybe share what you went through and where you are today?
Sure, Julie. Thank you for having me. My name is Willie Pearl Evans, and I am a person living in long-term recovery. I am recovering from heroin addiction. And I started using heroin at the age of 34 years old after some traumatic experiences. I am a survivor of sexual abuse as a child and as an adult. And I experienced some other traumas in my adulthood. And as I navigated the world with these traumas, I became emotionally distressed. I lost two family members, my sister and my aunt, who were some important figures in my life. And so not having the tools to deal with this grief, along with the other traumas that I had experienced as a child, I spiraled out of control. I started using heroin at the age of 34. And throughout my heroin addiction, I experienced a lot of difficulties with parenting, being able to go to my son's school and have a conversation at parent-teacher conferences. That was a problem for me. And my son was a stellar student, so he did not deserve this. So it was incidents like this where I was unable to communicate and be an effective parent that troubled me. And then also I overdosed countless times. After overdosing many times, without receiving any support on how to move forward and how to deal with my addiction, I continued to spiral. My life continued to spiral out. And so I had one incident that happened. My oldest son, I found I learned that he was using substance. And so that was a major concern to me, the intergenerational substance use. And so a combination of all three of these events, the childhood traumas, the ineffective parenting, and knowing that my son had started using, these were the things that moved me towards recovery. And so once I started searching for recovery and how to build my life back, I experienced some significant barriers at treatment centers. At the time when I was looking for treatment, there was only two treatment centers that served people who had heroin addiction, and that was Wilmer and one in St. Paul. And so I went to the one in Wilmer. I was disconnected from my community. I was unable to parent for my kids. The staff didn't look like me, so I felt overwhelmed and I didn't feel supported. And so I came back to Minneapolis, and I wanted to continue my recovery journey, and I did that through a MAT outpatient programming there was where this program had people that looked like me, people who had lived experience, and I was able to connect with that culturally specific programming, and that is how I began my recovery journey. And from that point on, I began to show up in recovery spaces to share my story. And from that, I ended up doing some legislative advocacy work. I ended up sitting on an advisory council, and a combination of that work and my dedication to wanting to return to the community and help others and elevate the Black recovery narrative, that is what led me to my work at Minnesota Department of Health.
Oh, Pearl, what a story. Clarence, let's start with you and a little bit about your work in the Black community specifically. But when you listen to Pearl's story, is it unique, or do you find that this is something that is really common? And if so, what are you hearing from your communities and what are you trying to do about it?
Well, first of all, let me thank you, Julie, for the opportunity to be here. And I am excited that I had a chance to meet Pearl. Now, one of the first things I tell people is this: I'm a community health strategist, and I was approached by one of our members, Dale Gates, who told me that opioids was a problem in our community. And I said, okay, I don't do opioids, so I don't know. I went to a colleague. I was a director at a federally qualified health center. I went to one of my colleagues, and I said, well, as human, we're going to be working around opioids. And she says, why? Your people don't do opioids. I said, okay, I don't do opioids. I don't know. But when I got out into the community, what I found out was that we are doing opioids. We just don't call them opioids. And immediately when that happened, it struck something inside of me, because I thought about the fact that, so here we are with an emerging issue, or a issue that's there, and we're going to play name games. We're going to use language. I thought about crack and cocaine. I thought about how unfortunate it was for our community because it was criminalized for us. And it was a medical epidemic for other people. And so we started doing community lunch and learns. We started meeting with government officials, HMOs. We started with the community to try to figure out what it is that we should do. And so our position at Human is to listen to the community, to find out what the community is saying, and to find allies that can help us to work together in order to address this issue. But we believe very much in the fact that it has to be community driven, as to be community led. And so that's what we have found. We recently, you asked me about people like Pearl specifically. One of the things that is so important for us is that we believe that people have to have their own narrative. Community have to have their own narrative. And so I can't go out and say, well, I think the community is like this. I don't do it. I don't know. And so we actually, with the city of Minneapolis, as well as with the University of Minnesota, we created a couple of surveys where we actually went out into the community and asked them questions. The first survey was really about, how do you identify opioids? What do you call them? And we found out that in our community, we don't call them opioids. We call it heroin. We call it oxycodone. I mean, there was like 15 or 16 other names. That's it. So first of all, we have to make it clear that when people are saying opioids, or they're saying this, that we are on the same page. After that, we had a grant from the city of Minneapolis to do like 400 surveys in North Minneapolis. They gave us 3 months to do them. We actually wound up doing over 500 in less than a month, asking people questions about, first of all, we asked them from an asset, a strength-based perspective, about your community, about your life. And then we got into the opioids, because one of the things that we were very mindful of, Julie, is that we did not want to come in and try to assume that we knew what was going on. We wanted to find out, how did people identify their own strengths, their own health, and then we could give the community the information so that they could have a narrative so that they can begin to address the issue. So what did we find? We found out after about these 500 surveys, where we compared not only Minneapolis, St. Paul to the rest of the world, that we have an issue here, and we have a variety of different things that we need to address in order to help people with opioids. We just can't say, well, we're just going to address opioids. There's some underlying factors that are here. And so part of what we are trying to do is to identify them using data and community language and community narrative in order to address this issue. And so we're very fortunate that we have been able to work with the community, and we'll continue to work with the community around this issue. There's much more to say, but I just want to leave that as a start.
And I'd appreciate that because I'd like to give Yusuf a chance to kind of explain to us, if you wouldn't mind, Yusuf, the community specifically that you work with and some of the unique challenges that you have to engage in to try to get some connection on this issue.
Hi, Julie. Thank you so much for having me. I'm honored to be here this morning with you guys. I am Yusuf Shafi. I predominantly work with the East African community. In the last alliance has been around for about 6 years or so. In the past 3 years, we have seen a lot of young men and young women that are struggling with opioid addiction. In fact, our referrals have changed. We see a lot more young people more than ever. And so there's a lot of stigma associated with using alcohol and drugs in general in our community. In fact, if you're using opioids, there's even more stigma. And so one of the things that we try to do is really important for us to educate people, what opiates are. This is an issue that's new to us, as a lot of everybody talked about. So this is something that is new to us, and a lot of our community members are struggling. A lot of young men are struggling, and the sad thing is a lot of the parents don't understand what opioid addiction is. So part of my job is to make sure that we educate people and meet them where they're at. People don't know what, services are available to them. A lot of them sometimes might not understand the process of getting to treatment, something that's new to us.
I was just going to say, we talk so much about treatment and what happens once somebody has a problem, or we know of somebody who has a problem. We heard about Pearl, and we heard about her struggles. And Pearl, you're part of a lovely collective community too. What do you guys find? I mean, for those of us who can't really identify, what are some of these traumas? How do you get upstream from this? Why are people using? Is it typically trauma, or is it recreation? I'd love for you to paint this picture.
So this is Clarence Jones. Part of what we found in terms of our survey is that there are a variety of reasons, especially now with COVID-19, that has really increased the use of opioids. The isolation, the lack of sleep, just relationships, domestic abuse, all of these things have really piled on top of the circumstances within people's lives, and has really caused them to look for external things in order to bring some kind of clarity to their life.
And for me, I would say many of the issues that I believe that people struggle with when they have substance use is the lack of programming that is responsive to their needs. For example, if I was a parent, I had 2 children, and at the time there was not a program to support my kids who had been traumatized from my substance use. And without that lack of support, my oldest son, he became addicted to substance use. So I think one of the issues that we need to start looking at is addressing this and looking at the whole person, as a parent, someone with children, helping the parent get treatment, that's a step in the right direction. But helping that whole family, how can we support that family? Because in my substance use, my kids were traumatized from the overdoses. They were traumatized from the whole process.
I think speaking for the East African community, and what I've seen in my work is a lot of the young folks that we see have some sort of a undiagnosed mental health problem, or a lot of them struggle with identity crisis. So a lot of them try to fit in, and maybe they're from the environment where people around them are using alcohol or drugs. And so they might try it, and then next thing you know, they might be, using it more often than they thought they would. And so I think that's what I'm seeing. And to be honest, a lot of them are numbing the pain. A lot of these young men, young women are in pain, and they're struggling with the COVID. It's been a lot more challenging for people to get out, in general, we're a community of, going out and talking and hanging out. So, being cooped up in the house or being, isolated, and so those things are not easy for us. So that's why we've seen a lot of more young people, struggling with addiction, specifically opioids.
And so how specifically do you try to close these gaps, bridge these gaps, make a connection and get somebody the help that they need?
Well, that was one of the reasons. This is Clarence again. That was one of the reasons why we did the survey. Is that, and I want to agree wholeheartedly with Pearl. Is that what we found out was that people were the least things that people were interested in was like more information about it, but they were more interested in the community. From our survey, just from this limited survey, they were interested in finding out where the programs were in the community that could help them to address these issues. And so part of how do we get there? Well, by making the community more aware of what they have self-identified as important for them, but also giving them the data and giving them the narrative in order to be able to go and to approach MDH or to approach the state or to approach the city to say these are some of the programs that we need.
I think for us, we just try to, meet everybody where they're at. We're blessed to have Alliance Wellness Center, which helps people from that community, and they have a safe space to come in and seek the help that they need. But I think it's really important for us to meet everybody where they're at and to also educate. Education is so important for our community, for people of color. Trust, it took a while for us to build a trust. So I think it's important for us to meet everybody where they're at and just to do a basic education. People don't even know about Narcan. Like, it took us, a while to get Narcan to people and make sure they have one at home with, make sure they have one in their car. As simple as that, as basic as that. So we have to sort of meet everybody where they're at and to also educate them. I think that's very, very important.
And for the sake of our listeners, Narcan is a brand name of naloxone, which is a drug that reverses an overdose, and it's given typically in an injection. And we'll have a lot more information on our MDH website on that as well. But Pearl, I wanted to get to you, particularly because you do have lived experience in this area. And do you find that you work almost like an ad hoc counselor for other people as well? Do they come to you and ask you how you were able to pull yourself out of this?
Yes, indeed. That is a question that I often get. And so I just share my story, and I also share what worked for me. And I also, encourage them to look deep inside and say, search for services that will meet you where you are. Like the harm reduction services, I think was so important for me because, like, I didn't know what Narcan was at the beginning of my continuously spiraling and overdose experiences. And then finally, I was able to get Narcan. That's one thing. And then another thing that Clarence mentioned that I want to echo off of is that, this is a community issue. And when we talk about my individual and lived experience, there are many other lived experiences out there that we often don't hear. And that is a way that I think we can address this, is when we continue to make spaces like this one, this podcast, to invite other individuals to share their experience. Because when we hear the lived experiences again and again, and we hear different lived experiences, that is also a pathway to someone else's recovery to say, hey, I know that person. She lived in my apartment. I went to high school with her. So recovery is about social connection. So hearing someone else on these podcasts, that'll help someone who is struggling right now today with substance use to make that connection and say, I'll reach out to them. I'll get in touch with them. So hearing these stories and hearing it from a lived experience, especially from Black Minnesotans, we are left out of this conversation because often it's said opioids. Just educate more on heroin addiction and just knowing that heroin addiction is real and that it is a treatable medical condition. And so just bringing in other folks who have lived experience and making those social connections, because that's how the recovery process starts. Recovery is a social network. It's building on what has worked for you, what has worked for someone else, and just sharing those stories and hearing those stories. That is an excellent path to building your own recovery story.
So I think we just saw an example of why we need to be really community specific around this issue, and that we need to be asking people in their communities what's going on. You have talked about the fact that there needs to be a lot of education and information in his community around this particular issue, and I understand that. When we talked in the Hawthorne neighborhood, they were talking about the whole issue around. They wanted to have more community specific information about what resources are available. And I think that's the challenge that we're going to have to undertake, because people get to this whole issue around opioid addiction or substance abuse addiction through different ways. And so we have to, as advocates, we have to be able to listen to the stories and give people what they need in order for them to make the decision, to make an informed decision about how they're going to address this. And it has to be community driven. So that was the point I wanted to make. So I agree with everybody.
I would like to ask each of you real quickly, just to summarize this as we're about done, because I hear such passion and I hear such energy from all three of you. Here's your opportunity to speak to Black Minnesotans. What do you want them to take away from this podcast and this issue? Clarence, let's begin with you.
I think the thing that I want them to really take away from this podcast is the fact that we have people in our community that really do care about you, that we want to know what are the issues that are causing you to be substance abusers, and that we are working very hard with other allies to try to find ways to address this, that you don't have to fight this thing by yourself, and that it's important for you to know that we do care. That's as simple as I can make it.
And Yusuf, what would you like people to take away from this podcast?
I think I wanted to say that, there's help available, there's treatment available. We are blessed to have programs that are culturally specific that can, meet you where you're at. I think that's very important for people to understand. And I think this is a treatable disease. It's like any other disease, it is treatable, and there's services that are available that are tailored to specifically you. So just make sure you try to get as much resources as possible. Make sure you try to get help, and we're here for you, and we're here to help you out.
And Pearl, you have this lived experience. What do you want people to take away?
I would conclude with recovery is possible. If you're in substance use right now today, just knowing that there is a community of people that are willing to support you, reaching out, making those connections is the first step. Recovery is possible.
Yeah, recovery is possible, and these deaths are preventable. And we, of course, at the Minnesota Department of Health will have resources and more information on our website. And we can also help connect you to Yusuf, Clarence, and Pearl. How can I thank the three of you for your time and your perspectives and your passion? Thank you again so much for coming onto this podcast today. We hope everybody takes away just a little more information and a sense of optimism that they can get help. With Stories from the Field, I'm Julie Bartke with the Minnesota Department of Health. Thank you for listening. We'll see you next time.
And so absolutely, people taking care of people, letting people know that you matter. Because I would tell you, Julie, that everybody who sees me for the first time, and this has been consistent for 25 years, talk about how they don't want to be a junkie.
And when did you find out Teddy was using? How long ago?
I found out that the day that she was crashing. When she had to be revived from the Narcan the very first time, and they had to have a breathing tube down her throat. It was frightening. And strangely enough, she was rushed to the hospital yesterday.
Hello, everyone. Thank you for tuning in to Stories from the Field, a series of podcasts that dive into the issue of the evolving opioid epidemic in Minnesota. Our goal? Simple: to give voice to those who are or have experienced substance use disorder and to provide perspective into the issue. Hello, everybody. I'm Julie Bartke with Stories from the Field. Today, you will hear from Anne Vandalak. She's a mother whose story is one that so many can relate to. Her daughter is battling substance use disorder. Also joining us is Sue Purchase. She heads up an organization called Harm Reduction Sisters, which provides naloxone and other services to those living in northern Minnesota. We're going to begin now, though, with Anne. As I mentioned, she is the mother of a young woman who is alive because of naloxone. It's a substance that reverses an overdose. Anne, can you tell us about your daughter, your life, and living with this day after day?
Where do you even start? It's just, for one, it's she's thrown me into a world that I didn't know at all, and never been a drug user. And it's been quite an education that I choose not to have. She's been in and out of treatment. And strangely enough, she was rushed to the hospital yesterday because she has an infection in her arm. And she just got her paperwork to go back into treatment again and decided to kick it off with her last hurrah. And so, I just literally got back from the hospital to see how she is. She doesn't need surgery. She's going to be okay, but heroin is a nasty thing. And it's been a roller coaster ride and incredibly frightening because I've almost lost her several times.
And to that point, there is often a stigma attached to those who misuse opioids, and that's one of a lower socioeconomic status. Tell us a little bit about her upbringing.
Her dad is a retired Navy person. We divorced when the kids were pretty small, but a good upbringing. I been in media and definitely had a good income, a good home. I have a son who has just been incredibly successful living in Minneapolis. I mean, they couldn't be more opposite. Teddy dropped out of high school when she turned 18. She turned 18 on March 30th and could have graduated on May 5th. And now she's sitting here without a high school diploma. You know, it started with her with the cutting. So when she was about 15 years old, she started cutting. And I got her into counseling. And, I can't explain. It has nothing to do with too much money or not enough money. We're, a really normal American family. But she progressed into marijuana, which was a trigger drug. What is the right word for that? I'm sorry. Gateway drug, sorry. And what she admits now, and then just progressively went into all these other drugs. It's not a life that I grew up with or that I've experienced. She to feed her drugs, she danced at a strip joint for about a year, and just lived a lifestyle that was never part of mine or my son or her dad.
And when did you find out Teddy was using? How long ago?
Oh, I found out that the day that she was crashing. She was when she had to be revived from the Narcan the very first time.
How long has this journey been? Is probably a more appropriate question.
The heroin part has been about 2 years. Yeah, it seems like 20, but it's been 2 years when I found her, and with her boyfriend. He had been using too, and I knew something was wrong. And they had to have a breathing tube down her throat. It was frightening. It was really, really scary.
As a mother, this has to be just a really hard thing to live with. However, she is still alive. So do you have a sense of hope?
Yeah, honestly, I do have more hope. But then, I don't know how to say this, but it's just been so hard. And again, I almost lost her several times, and I'm trying not to get numb. And I've always been the one that's been there for her, that she could count on. I'm the last one left, and the rest of the family has given up on her. And something that came up, Julie, that I remember talking to you about is one of my coworkers that knows and has been around during, I've been at the same job since Teddy started on this path of drugs. And she said to me that I was a master enabler, and that if my daughter overdosed and died, it would be on my head. And that was one of the cruelest, hardest things for me to accept or understand. And basically, that's the impression people have. They don't think that there are people like me that have kids that are battling drug addiction. I'm sorry, I'm all over the board.
Sue, I'd like to talk a little bit deeper with you about this. We know that Teddy was revived by naloxone, also known as Narcan. You work very closely with this area, helping people gain access to naloxone throughout greater Minnesota. So tell us a little bit about what you do and some of your experiences.
So my experience in harm reduction is really based on personal experience, from my own experience growing up in northern Minnesota, from my experience being a mother to a daughter who also struggles with substance use, as I did myself. And so I have a different understanding of substance use and overdose, and prompted by my own life experience. And then the work that I have done for almost 25 years. And a lot of it has been in Minnesota. But to really focus on Duluth, I've been back I've been having Harm Reduction Sisters is almost 2 years old. And so it's a really busy program in terms of overdose prevention. And I provide so much more than that. It's hard to sort of encapsulate it, but I run a mobile harm reduction program based out of Duluth, but really serving all of northern Minnesota, and distributing clean works, clean supplies, clean syringes, along with Narcan, and then all the other equipment that is needed to safely inject, and hopefully to promote public health, that you don't share syringes and you don't share equipment, and helping people stay safe until they can do something different. And I think in terms of overdose and Narcan distribution, it's been challenging. And being able to have conversations with people about the importance of having naloxone. And a lot of times, people don't fully appreciate or understand, all the implications of drug use. It's a much different scenario now than it has been in the past, where traditionally it was methamphetamine and cocaine and what we knew as heroin, and it's not that way anymore. The heroin that we have is fentanyl, generally speaking, and it's laced in everything, and so there's no predicting about overdoses. And trying to get education to people, and working with them one-on-one in brief encounters. That's a lot of what I do, is talking to people about how important it is to have Narcan, and to be prepared, and to know how to use it, and to really work to inform people to have a safer experience for people who are using drugs, until they, like such a time that people want to do something different.
But I think that really encapsulates things so well. And Sue, as I listen to you, I want to ask you more about the kind of response that you get from the general public throughout the Iron Range and throughout Duluth. Because you talk about providing supplies to people who use, and sometimes that might not be a really popular approach.
I would say that the people who need me the most love me. They're shocked and surprised that I live up here and that I deliver supplies to people, no questions asked. And I think that there's a lot of speculation about why I do it. There hasn't been a lot of what I would call like blowback. I think that it's overwhelmingly been supported, but I have not been in a position, to have maybe criticisms of this sort of model. I cut my teeth in harm reduction in HIV in the 1990s, and so there's I know that I am convinced that doing harm reduction work, providing syringes and Narcan to people, save lives. And that is what is most important to me. I build a bridge to people who are living in isolation, geographic isolation, emotional isolation, and where drugs is really the friend that they have, right? And so many people have experienced trauma in their lives that, in my experience, makes it difficult to live inside your body. And so you want to do something different to lighten the load and to self-medicate. And I think that that makes so much sense to me. And I think that if there's opportunities for education and for people to think a little bit differently, it really helps. It helps this work.
So, Anne, you and I were talking a couple of years ago when the idea for this podcast was just beginning. And at that time, you knew your daughter had an opioid issue. You knew about naloxone, but you didn't carry it. So now you're meeting Sue. And what do you think of her work and what she's doing throughout the Iron Range and in Duluth?
Well, first of all, yeah, I remember telling you that I was shocked that I never thought to carry it. And that just kind of floored me. But no, after we met, I went straight to my pharmacy and got my own and carried it, and I continue to carry it with me. I think what Sue is doing is absolutely fabulous. It's fantastic. The at least the kids that my daughter hangs with, I guess they're adults now, but they know about the different places to get the clean needles. They know how to get the Narcan. My daughter has a major supply of Narcan, and it's fantastic. I mean, who knows how many times she may have saved her own life, because I'm not getting the truth on these different things, of course. And I just think what you're doing is wonderful. And until they can get to that point, I mean, my daughter was suicidal, and it's been about a year and a half since she's talked about trying to kill herself. Now she sees that she does have a future, and so even though she's still relapsing, the periods between relapsing is longer that she's sober. And we can always hope that this is going to be the last time, but if it's not, then I want to make sure that there's people like you, so she's not in the hospital with an infection from a dirty needle. And I think what you're doing is a wonderful, wonderful service. So thank you.
And we want to clarify real quickly that nobody can save their own lives from naloxone, but having it and having those in the room with you when you are using that, and make sure they know where that naloxone is if it's needed. That's the important component here.
Right.
Sue, I wanted to ask you then, what if, to all the other people who are listening to this podcast right now, throughout Minnesota, there are so many areas that are remote, and I would love for you to provide maybe some guidance if somebody's looking to starting up another mobile unit such as yours, or find a different, more unique way to increase access to naloxone. What would your advice and guidance be?
Well, I think that setting up a program like this isn't easy. I would say that right off the bat. But in terms of northern Minnesota and wanting to be able to distribute naloxone to like a community of folks, that can happen through me. what I do is not only do I do delivery, but there's this secondary network of people set up throughout the Iron Range and Itasca County who have enough supplies to take care of other people in their community. That's really how all of this works, is this amazing network of primarily women, but not exclusively, that are really working with me to support their friends, their family, their loved ones. And I think that it's very worthwhile. You know, certainly it's controversial work, the nature of it. But it's life-saving. It is a life-giving force. And that, you know, supporting people to make incremental change in their life, and supporting any positive change as people choose to define it for themselves, and to have an ear that is not judgmental. Because I think that, you know, like my way of thinking about this is that we know now more and more that it's traumatic episodes and complex trauma and PTSD that leads to drug use. And so, do we want to punish people any more than we already have? You know, stigma and denying supplies to people, which is a lot of what has happened in northern Minnesota, that people don't have the access they need to take care of themselves. And so there's resulting trauma that comes from that, whether it's the overdose deaths of their family, their friends, you know, or infections with HIV, with Hep C, endocarditis. I mean, the long list of repercussions are, you know, like it just drives drug use.
And as you talk about that, we realize that everybody has their own story. Everybody has their own reason for turning to drugs, for whatever that reason is, whether it is trauma or recreation. We've seen that over and over again. I'd like, Anne, if you could, you right now have the ears of many, many people in Minnesota. Many of those could be parents who are experiencing the same thing you're experiencing right now. And this idea that recovery is possible, that light might be dimmer for some than it is for others, brighter for some. And what would you like to say to parents and to caregivers and friends of those who are experiencing something very similar to you, seeing a loved one who, you know, is trying to turn things around?
You know, thanks for asking me that, because that, of course, has come up on so many occasions. And I think that the biggest advice is just to never stop loving them and never stop caring. And, you know, I during Teddy's suicidal time, it was devastating because she really didn't want to be on this earth anymore. And I'd hear that on an ongoing basis. And I just kept loving her and kept hanging on. And, you know, I think we're going to get through this. I am not a tough love person. I just did it from my gut. And yeah, I know she was using again this week, but again, she's getting better. And those times of sobriety are getting much, much longer. I've never stopped caring about her. And, you know, I'm careful about giving her money, of course, and buy her groceries instead. But just never giving up on her, because, you know, she's my baby girl, and I love her to death. And I just want to make sure that she has a future, and we talk future all the time, constantly talking future.
And are you optimistic?
I am. I think, you know, I think she's going to make it. She's getting closer, and you know, her choices have still been bad. This last deal was she got her $600 check. Sorry, I can't even think of the name right now.
The stimulus check, yeah.
The stimulus check, thank you.
Mm-hmm.
And just having that kind of money, and, you know, she knew she was going back in, because we've been getting to that point of getting her back into treatment. And she went and blew it all on heroin.
How are you practicing self-care the caregiver of the person who is going through all of this. Do you have a support network?
I do. I do. As a matter of fact, it's funny because in my building is the Duluth Public Health, Minnesota Department of Health, the Duluth version. And there's a woman there that we've gotten real close. And she has a son that's been in recovery, and he's been in recovery for about 20 years. So I do find myself feeling a little bit lucky for that. But I've got several friends, not the friend that said that, of course, but a lot of friends that helped me get through. My son's been just a rock. And but yeah, it's I have to remember and remind myself to take care of myself too. It's a slippery slope.
Sue, I'd like to close with one last question for you. As you travel through greater Minnesota and the northern part of it in particular, do you find yourself also being the conveyor of optimism?
I think that I am. And, I think that it's absolutely crucial and to give people some perspective. It's been a year of COVID and the other needle exchange programs shut down up here. There's one that is reopened, but the other one is primarily closed. I've been super busy. And but it's really so rewarding and so, I would say, invigorating and inspiring, because what I try to do in talking to people is how really to support and encourage people, that any positive change and that we're in this together and we are building community and that we are providing low-level guerrilla healthcare to people who need it the most. And so absolutely, people taking care of people, letting people know that you matter. Because I would tell you, Julie, that everybody who sees me for the first time, and this has been consistent for 25 years, talk about how they don't want to be a junkie, and they talk about their shame. And what I say, like, I don't accept the word addict. And, like, recovery doesn't really do it for me either, but I get where people are trying to go, and that people are people. There's somebody's daughter, there's somebody's mother, a sister. They contribute so much more to this world. But what we do is we focus on the drugs. And I don't think that we do that to people who consume alcohol or to, like overeating or heart disease, but we find that it's okay and open warfare on people who are struggling with mental health and homelessness and all the other isms that come to people in this life and trying to navigate it. So I absolutely try to build people up and encourage and support them. And in doing harm reduction work, my whole thing is people will oftentimes say, Sue, when I get sober, I want to do what you do. And I say, you can do it now.
Oh, Sue, I will consider this podcast a success if your phone starts ringing off the hook and your email fills up with people asking for advice and guidance on how to move forward with the kind of work that you do. Sue, Ann, thank you. I can't thank you enough for sharing your insight and your perspectives. With Stories from the Field, I'm Julie Bartke with the Minnesota Department of Health. Thank you for listening. We'll see you next time.